Professor Dr. Mahipal Sachdev is a Padma Shri awardee and one of India's most respected ophthalmologists with over 42 years of experience in advanced eye care. Trained at the reputed hospital AIMS with a cornea fellowship from Georgetown University, USA, he is the chairman and medical director of Center for Sight, a pioneer of SMILE, bladeless LASIK, femtocataract, and modern cataract surgery in India. He has also served as the president of the All India Ophthalmological Society. This podcast clears common eye health myths and explains vision care with simple science-backed clarity. It can be a little bit medically complex, so stay till the end of the podcast. Let's dive deep into it. So, Dr. Mahipal, I'm going to start right off the bat.
Okay.
Kids are wearing more glasses today. Do you think it is related to screen time?
Oh yeah, 100% it's related to screen time because when COVID came, for example, following that, when people were just confined to the houses, like there was a lockdown and things like that, so everybody was within the houses. At that particular time, post-COVID, there has been what you can call a myopia epidemic. So there are a lot of people who have developed the need for wearing glasses. And obviously that's because outdoor activities were kind of shut off and the people were just concentrating on the screens. So essentially this has been proven to be the two most important causative factors for increase in myopia apart from hereditary. One is that if you spend more time doing near work, because the eyes are basically made for distance vision. And whenever you're doing a lot of near work, there is some amount of strain or you can say the ciliary muscles go into overaction. And
Ciliary muscle, please explain that, please.
Ciliary muscles are actually the muscles within the eye which kind of control the shape of the lens, which you can, like if you're a young person, while you're looking at distance or near, your focus needs to change. Like in a camera, you can focus. So the ciliary muscles help tone up the lens into various modes, like it can change its curvature. So when you are reading, the normal reflex is that you have to actually get a more power for reading. So the ciliary muscles can change with the contraction and all the lens within the eye, it changes its focus. So therefore, the eyes which were normally made for distance vision, when a person is reading or doing near work, there is a strain that is there. And this has been shown to increase the length of the eyeball, and that leads to myopia. Okay. The second thing is that when you are outside, when you are with the sun exposure, etc., dopamine, as you would know, that is being secreted. And if you don't have dopamine that is being secreted, that can also lead to elongation of the eyeballs. Okay. So these are two major factors: lack of exposure to sunlight and excessive near work. So excessive near work, everybody is nowadays on the screen. So that's what happened. So you would be astonished to actually look at the numbers. If you are looking at the East Asian countries, you're looking at, say, Taiwan, Korea, Hong Kong, Singapore, China even, 70% of the young adults need minus glasses. That's called as myopia. And even in India, see, we don't have those many cross-populational studies, but we are observing that almost every year, the percentage of patients who are needing to wear minus glasses is increasing by 1 to 2%. Because you are just being indoors, you don't get exposure to sunlight, and you are always training yourself for doing near work. So much so that in Singapore, the Singapore government has made it mandatory for children to be out to do outdoor activities minimum 1 hour a day in the schools. So those are important things. So yes, there is a myopia epidemic, and a lot of it is related to the screen time that we are spending.
Are we just talking about kids, or is it same for young teens, kids, adults?
See, what happens is that the eye is in the stage of growing. So typically the myopia tends to stabilize in boys by about 2021 and maybe in girls by 18-19 years. That's the age by which you reach maturity. So the incidence of myopia grows more in children. than when the eye has matured. So it does have a tendency. There are people who have developed myopia even in the mid 30s or something like that because of the change in the occupation or the profession or being just on the computers. But yes, you are right. Typically, it works more for kids.
Kids.
Yeah.
So the outdoor exposure for 1 hour per day is what American Association of Pediatrics is also saying.
Oh, great.
Not only for eye health, in general.
In general,
In general as well. So if a parent listening to this podcast and then he's thinking that, hey, in the morning 7:30, 8 a.m. they're going to school.
Yes.
So there is no sunlight exposure over there, either in the bus or car or, whatever the modes of transport is. In the school, they do have some kind of physical activity, but not on a daily basis.
Yes.
They come back in the evening and they have tuitions to attend, and there is no exposure at all. If this keeps on happening,
Yes.
should the parent be concerned that the vision could be compromised? And what are the early signs that they can see?
See, anything which is important is that you should detect it timely.
Correct.
Right? So the early signs would be that you might be telling your kid that your performance in school is going down, and the kid is sitting at the back bench, maybe just by chance he's sitting, or he or she, and they can't see what's being written on the board or on the screen, etc. And obviously he's not able to comprehend from that point of view. So a kid being irritable by the time the kid comes back home, or having headaches, or screwing his eyes to kind of get a better image of what he's seeing, or sitting very near to the television screen. So these are early signs. But the problem here is that the parents would have a ruler or a giraffe in their house, which they will be measuring the height of the kid. But nowhere are they even taking the kid or looking at whether the child has any visual disturbance or not. See, today on the screen, you can have the Snellen's chart, the chart that you project when you go to an optometrist or you go to an ophthalmologist to read the size of the letters, etc. And you can customize it as per the screen size that you have. You can go online and do that. And you should make the child with each eye separately, just at least see what he or she is able to see. So there is no emphasis on eye health or the parents looking at what the child is able to see or not. And when they come to know that the child needs glasses, they start weeping. So the point is, had that been known earlier, maybe the progression of myopia would have retarded, because if you are not giving glasses and a child needs glasses, then under those circumstances, the strain continues. Rather, there is an overstrain. You are overusing your eyes, and the myopia would progress more rapidly.
Follow Center for Sight and post your queries to get answers from the experts.